Hi, guys, and welcome back to the Female Fitness Podcast. I'm your host, Danny, and today I have the pleasure of being joined by Dr. Rumbi. Rumbi is a doctor, prior midwife, and founder of Glaciehealth, which is a women's health consultancy run by doctors. So, to begin with, Rumbi, for those of the listeners who might not have heard much about you or your story, could you tell us a little bit about your journey in medicine from kind of becoming a midwife and then a doctor following that?
Absolutely. Thank you so much for having me. So, my journey, I would say, let's start it at A levels. Otherwise, the very long story will be too long. I applied to study medicine because I think that was always my calling. Unfortunately, I didn't get a place, and I thought, oh my goodness, what do I do? Do I take a year out? Do I go and study biomedical science or something else? And then I thought about, I think maybe that was a position of self doubt and worry. What if I study something like biomedical science and then apply for medicine again and then don't get in?
Yeah.
What else can I do which I will really enjoy? And that's where I found midwifery. I think it was an amazing choice and option for me. So I applied, I got in, I studied, and I had a wonderful time. It was a really difficult course, but the life lessons I learned in that, I think are still lessons that I benefiting from right now. So after studying midwifery, I then applied to study medicine. I got in and then I became a doctor. And I think the combination of both things really shapes the practitioner that I am today.
Yeah, amazing. And with that in mind, what was it about kind of midwifery that contributed to your practices as a doctor?
I think as a midwife, you're supporting women and families in one of the most exciting but also vulnerable times in their lives. So their needs and how they express that, I think is really important. It makes you so attuned to things. And I mean, pregnancy and birth can be a very, very happy time, but it can also be a very sad time. It can be a very scary time, anxiety filled. And a lot of the things that some women experience in general around fear, anxiety, also in joy, and kind of expressing that. In other healthcare settings, we don't get to see in the same way. And so when you have that really concentrated experience, you can take it back into all practice.
Yeah, I love that. And I guess it's just experience working with people, which obviously
Yep.
benefits all of those roles as well. And for the listeners, do you still practice as a doctor now as well as having Glacier Health?
I do. I do still practice as a doctor. I think it's really important for me to maintain that because it's part of who I am almost. I feel it's a part of my identity, and I will continue to practice as long as I can.
Yeah, I love that so much. And I think it's obviously it's a really important role in itself that you're there for, but it's also great for you to practice as a doctor whilst working on like advocacy and things like that as well. And one of the things I wanted to touch on during the podcast for the listeners is that we know it can take a really long time for women to receive diagnosis and medical support. What are some of the kind of barriers that often get in the way of women receiving the support that they need?
There are so many that we can speak for 2 hours, if not more, about the barriers. I think some of the most commonly heard ones are not being listened to. I think the government commissioned a women's health survey a few years ago, and about 83% of women said that at one point or another they felt not listened to by their healthcare providers. That's a huge, huge percentage of women. So just the first section being not being listened to, that's a huge barrier if you're presenting with issues and you're not being heard. I think beyond that, it's also systemic issues. I mean, misogynoir, we talk about medical gaslighting. There are so many layers that really impact upon that. I think the first and the most important one, like the first barrier, just being not being listened to.
Yeah, yeah. And I agree in terms of like obviously I work with clients one to one and I see that with them when they go to their doctors, their medical professionals. It's really common for them to feel that way. But I and I think people need to understand that obviously when it comes to GPs, for example, they have very limited time, very limited resources, and often that's part of the issue there. It's not that they don't want to listen, it's not that they don't want to give people more time. It's just that there's a natural barrier there in terms of the time that they have available and the resources they have available.
Absolutely. And it's a shame because a lot of the time you already attend your appointment starts late and you're already flustered. Now you feel rushed because there's a time limit, but what you want to discuss takes more than 10 minutes, takes more than 20 minutes, to be honest, and a lot of times too, especially when it's the first appointment and it's a clinician, a doctor that you don't know. So really getting to the bottom of where things started, how they are now. And so those are really, really big issues. Some ways to try and go about it is asking for a double appointment. Now, not every surgery allows this, and not every surgery allows you to request it. Sometimes they'll say, no, the doctor needs to approve for it to be a double appointment. So that's one way to kind of try and combat that. But it's a big, big issue.
Yeah. And with people, if someone say they wanted to try and get a double appointment, how would they go about that? Would they just call their GP?
Yes, so it depends how your surgery takes bookings. If there is an e-consult service, then I would fill in all the details, I would explain all my symptoms, and in part of that, I would make it clear that there's a lot that I want to go through. It is more than one problem, or it's one problem that's been across a long time. So please, may I have a double appointment? If your surgery has e-consults, I prefer that because it means you actually have time to write it down, to word it properly. Whereas the phone call, sometimes by the time they've answered the phone, you've been number 10 in the queue and you're flustered and you don't get as much of a chance to ask for what you want, the double appointment. So yeah, definitely if their appointments are over the phone, ask when you ask for your appointment. But if they have an e-consult service or an online triage service, I would put it in there.
Yeah, that's super helpful. And is there anything else that the listeners could do to help make their doctor's appointments as productive as possible to help them really get the most out of it?
It shouldn't be this way that someone experiencing symptoms, you're going already with knowledge and data and everything to your GP or to your doctor or your clinician, whomever you're seeing. But I think it is really, really important in the day and age that we find ourselves in. So I would say before your appointment, think about what your ideas, concerns, and expectations are. What do you think is going on? What are you concerned about? What's worrying you? And what's your expectation? So sometimes an expectation could be reassurance that this is normal. An expectation could be referral for a specialist. An expectation could be blood tests. It could be review in 2 months. Everyone's expectation varies, but just be clear about what you would like from the appointment, as well as what you think is going on, and don't be afraid to utilize the NHS website, NICE, NICE, that's where we get our guidance in the UK, to utilize that if you can, or other reputable sources to guide your feelings about what might be going on. So when you come to your appointment, I think also it's helpful having a symptom diary.
Yeah.
So where you say how frequently you're having the symptoms, how they're affecting your quality of life, any other associated symptoms. And it does not have to be anything fancy. It can literally be a bit of paper and you write it down on a bit of paper. You don't need a special app. You know what I mean? Just something straightforward to start with. And then you can present all that information.
Yeah.
Now, the downside with the symptom diary is in terms of, I think a symptom diary you need to have in the context of a 10-minute appointment, relaying that information. Sometimes you might have to do the summary. So I've kept a symptom diary and I have noticed XYZ. Would you like to take a look? Versus, here's my symptom diary, you can take a look. Because if we think about time and utilizing that time, maybe you presenting the summary of your symptom diary might be the way forward.
Yeah.
And then just, I think it's important to lead with your ideas, concerns, and expectations because I don't want to use 9 minutes as the doctor asking you these questions and I'm going down this path where I'm thinking this is going on. And at the end, you say, oh, actually, I was concerned about this. and I was hoping for this. And I'm like, oh, I was going on a completely different path to the one you were going on. So now we're rushing through your ideas, concerns, and expectations. So I would, if you can, hi, oh, hi, my name is Dr. So and so. Oh, hi, my name is, how can I help? Well, I'm concerned I have this. This is my idea. I would like this. Like, really get it out early if you can.
Yeah, I think that's a really good point because I guess it does have to be a collaboration to really get the most out of a doctor's appointment because you're going in to see someone who has no idea
Yeah.
about your symptoms, your history. You have obviously lived in your body your whole life, so you're much more in tune with that and you know what's kind of normal for you and what's not,
Mhm.
whereas the GP doesn't and they don't have any insight into all of that. So I guess communication is really important when it comes to getting the most out of those appointments.
Absolutely agree.
And with the symptom diary, do you think that with that in mind, the fact that it can be so helpful, people should keep kind of a general symptom diary pretty much throughout their lives, even if it's kind of rough?
It's interesting to say that because sometimes you have to think about quality of life. Do you want your life to be symptoms or do you want it to be life? I think journaling is important as a whole. I think it's important to journal. I find it very helpful, but I wouldn't want my whole life to be focused on problems. So when we talk about symptoms, it's often negative things that we're experiencing.
Yeah.
When we talk about symptoms, we don't often talk about positive things that we're experiencing. So I think to be too centered in that can be difficult across your life course. But if you know, okay, this is an issue I'm experiencing, and I want to get it sorted in the next 1, 2, 3 months, fair enough. But a year of symptom journaling, I think then it really it becomes a point where, and this is a different type of conversation, I guess, where particularly people with living with long-term conditions where they want to be themselves, they don't want to be the condition, or they don't want their life to just be the condition. And when we symptom diary 24, like all the days, every month, that encroaches into that remit of are you is your life just becoming the condition versus life?
Yeah. And I guess even the kind of stress that can come with that hyperfixation on symptoms and whatever, health struggles you're experiencing in itself can like cause more stress, potentially make the condition itself worse, lessen your quality of life, like you said, and even potentially become a bit of like a self-fulfilling prophecy where you're so focused on these symptoms and like, do I have this? Do I have that? That it makes them more likely to kind of present.
Mhm. Exactly. And I guess it's a wider conversation. Unfortunately, women's healthcare conditions are not being solved as quickly, delay in diagnosis. So it might end up being, for example, if you come to see me, I refer you to gynecology, and then there's a 7 or 8 month wait for you to get an appointment. I'll be encouraging you to keep a symptom diary, but that's 7 months,
Yeah.
of experiencing symptoms before you see the specialist. So it's a catch 22, I think, that people are finding themselves in. It's a difficult climate at the moment.
Yeah, yeah, it's really difficult. And what if anyone say they do go through that process and they get a referral that they're waiting a really long time for, what would be your advice for those people in that moment to help them kind of continue to live their lives whilst also dealing with everything that's going on?
It's difficult and it depends upon the impact of the symptoms on someone's life and also how long they've been having those symptoms. I guess if these are symptoms that someone's been having for 10 years, for 5 years, they have already been living some semblance of life in that time. So really trying to lean into that, lean into the things that bring you joy, the things that you're excited about whilst waiting for the appointment. Because sometimes, and unfortunately, you have the appointment with the specialist, and let's use gynecology as an example, just in the frame of women's health, you have the appointment with the specialist. That's also usually only a 20-minute appointment. And
Yeah.
that's an appointment that you've been waiting for months for symptoms that you've been experiencing for an even longer time. So trying to pack everything into that appointment is tricky. And then sometimes they offer you solutions. Sometimes they offer watch and wait. Sometimes they say, okay, let's list you for something, and now you're back in another waiting list. So I agree with you that it's really important to think about ways of maximizing quality of life in the interim because even after that appointment, there might still be lots of waiting around the corner before solutions.
Yeah, 100%. And I don't know about you, but from working with a lot of clients, like in the general population, people generally tend to fall into either the camp of like being kind of hyper aware of their health and always going, like booking a doctor's appointment if they see a small thing wrong,
Hmm.
or the other kind of side of things where they will never go to the doctors, they'll never book an appointment, they'll just kind of like crack on.
Hmm.
Um, do you have any advice to kind of like help people combat those two mindsets and kind of shift towards more of the middle ground where they reach out if they're really struggling with something, but they don't kind of reach out unnecessarily, or on the flip side of that, just ignore things and try and crack on?
So I really remember this experience that I had with when I was a medical student. So before I became a doctor, I had a placement in general practice. And the GP said to me, there's no such thing as a unnecessary appointment. There's no such thing as a silly complaint because someone's taken time out of their day to book this appointment. They have called, they've probably waited 10 minutes on the phone line, or they've spent 10, 15 minutes filling out an e-consult to get this appointment. And that really stayed with me. So sometimes, if we're talking about the people that are more alert to their feelings, so sometimes they might come with what we might think are small things
Yeah.
that you or I might not necessarily go to the doctor with, but that's what you have to unpick what's underlying. Is there something else which is driving worry or anxiety about this symptom? Which led them to spend 10, 15 minutes on the phone, wait 2 weeks for the next available appointment before coming to sit in the waiting room for 15, 20 minutes before getting to see you. So that really stuck with me that there's no such thing as a silly appointment or why, saying, why did you book an appointment for this? Because there's always a reason. And sometimes unpicking why that reason is, that's the important thing. The reason might not be because I'm really itchy on my hand and I've been really itchy on my hand for the past 2 weeks and I don't know why. It might be something else. And again, it comes to the downside of the system is we actually don't have time to really unpick what that something else is. So it's tricky. And for the other extreme of people that just don't come in unless a limb is falling off, everyone has their own tolerance and threshold. Who am I to say that the middle ground is the best place to be,
Yeah.
Because what if those people, if they lean more towards the middle ground, end up with investigations and labels? Because when we diagnose someone with something, we give them, it's a label of some sort, and maybe that condition or symptom would have never impacted their quality of life. But now that they've been labeled as having something, it's a thing upon them, now it's
Yeah.
something that they think about. So it's hard to know what's best. And I don't know if the middle ground is best. I would say people are who they are.
Yeah. And I think your point about making sure, I guess, people don't feel dismissed is really
Hmm.
important, because if someone does feel dismissed for something that they're concerned about, they may then be less likely to reach out for support again in the
Yep.
future. So yeah, I really love that point. And on the with you talking about a symptom diary and the kind of like potential benefits of that, but not for too long, are there any other sort of routine health checks or record keeping that you'd recommend women do for themselves?
Oh, yes, absolutely. I think knowing what you're eligible for within the health service is important. So, if you're eligible for screening like cervical screening or smear tests, if you're eligible for breast screening, all those, definitely keep up with them because that's preventative. And I think the most important thing is let's prevent. Let's
Yeah.
not get to a point where we have a condition. Let's try and prevent it if we can. And obviously, not everything is preventable. A lot of things happen. And interestingly, a lot of things, particularly women's health things, happen and we don't know why. The research is so, sparse.
Yeah.
So I would say keep up with your screening. And in terms of your monthly checks, so at the first of every, I would say check your breasts. If you can, check your vulva, especially externally, because things like conditions can happen on the vulva. And because it's not somewhere a lot of women look, they don't know what their vulva looks like. They don't know new lumps and bumps, etc. So definitely to take a look at your vulva. And also just checking for things like new moles, all of that. So I'll do first day of the month, all over check. Check the breasts, check the vulva, and also check for any new moles.
So, on the subjective check-in for moles, what should people actually be looking for other than new moles appearing?
Anything that's changing in shape. So let's say you see it, you keep an eye on it for a month, you find that actually it was nice and circular. Now it's a weird, elongated shape, or it's changing in its shape, changing in color, or has different colors. So most moles are actually quite uniform. So they have a same type of color, maybe even two colors within them. But if you find actually it's got very a lot of different shades, it looks uneven. And sometimes they call it the ugly duckling mole, because a lot of us have lots and lots of moles, but one that really sticks out because it's got different shapes, it's irregular in shape, irregular in color, that could be something that stands out. Also, if you're finding that there's bleeding coming from the mole, or it's big,
Yeah.
if it's significantly big, I would also get that checked out.
Yeah, that's super useful. And when it comes to these skin checks, what should people be looking for when it comes to like bumps and lumps and things like that?
If we're talking about the vulva specifically, then I would say any new pigmentation, so any new moles on your vulva, and when I say vulva, I would say just Google what I mean, because sometimes it is a bit confusing for people
Yeah.
to think, what is the vulva? What are we talking about? Women's health anatomy and female anatomy is a whole minefield in itself. But yeah, looking for any new pimples or moles or ulcers or stuff that goes inside that's dug in, all of those I would say to get checked out.
Yeah.
There's lots of different conditions that can present there.
That's super helpful. And when it comes to period pain, it's obviously something that a lot of women experience. Is it normal? And when should people think about actually seeking support for any pain that they're experiencing?
I actually had a really interesting conversation with a colleague of mine, one of our Glacie doctors, about is any form of period pain normal? And I think we all have to gauge ourselves. If you're finding that this is pain which is impacting your quality, is so important, guys. It is so, so important because that's all we have really is the quality of our life. And if something is impacting that, okay, it's sounding like it's a problem. If you're vomiting with pain, you're kind of doubled over, you can't do the things that you would normally do because of period pain, that's not normal. And also pain that you feel is above your comfort level, that's not normal for you. So I I always say it's very individualized, and there's no way that we could all stand here and experience the same level of sensation or pain, but how I interpret it, how you interpret it is different. So it's a difficult one to say, but I would always err on the side of period pain is not normal, particularly if it's not normal for you, as in this is a big change. If you're finding that actually your periods have always been painful, they've impacted your schooling, they've impacted your work, they impact how you go about your days when you're on your period. Again, that is not normal.
Yeah. And if anyone finds themselves in that position where they've realized actually this isn't normal for me, or it has always been extreme, when they then take that information to their medical professional, how should they kind of communicate that? And should they take any other information with them? Because I know, for example, some clients of mine may have been to a GP with
Hmm.
pain and have been told, it's normal, it's just your period pain, that kind of thing. But for them, it has felt extreme. Like, how would
Yep.
you advise they approach that?
I think the first thing we come back to is what would we like from the appointment? If I find that the period pain is, if I'm experiencing period pain, which is really painful and an extreme, not even extreme, just really painful, and I think there's an underlying condition, okay, that's the first thing that's on my mind. I think there's something underlying and I would like it investigated. Or if I think actually my periods are painful and I've seen a lot of stuff on in the media and social media saying any kind of painful periods are not normal. So I just want some reassurance or just to have a chat with my doctor to see could there be something else going on? Is there something I should be worried about? So thinking about what your expectation or what your concern is, I think is the best starting point. Because when you go, you can then talk about the pain in the periods. Important is how they're impacting your quality of life. I think that's the most important thing. So take some time before your appointment to think about how it's impacting your way of living. Is there things that you do on other days that you're not doing because of period pain?
Yeah.
Think about other things that the period pain might be associated with. So, like we mentioned earlier, the vomiting, the kind of doubled over. Are you using any pain relief and does it help? So that's things that you can find over the counter. Are they helpful at all? And also start to think about, are there other things that are associated with the period pain? Are your periods heavy? And then when we start to talk about heavy or not heavy, what does that mean? I mean, are you having to change your pads every 1 to 2 hours because they're soaked, they're really saturated? Are you needing to use more than one type of period product? So are you having to use tampons and pads because you know that the tampon will get really saturated quickly and will start kind of leaking onto the pad if you didn't have a pad on. So those kinds of things are worth thinking about, whether or not you're passing clots. And then the wider picture, what's the family history? Because sometimes people start to talk to their mothers, their sisters, their aunties, and they say, oh yeah, I have painful periods. And actually turns out I have endometriosis, or turns out I have fibroids. And then you've got three members of your family that have the same thing, and you think, huh, could this be what's going on for me? So I think those are important things to think about before your appointment so you can have that information at hand.
Yeah. And on the endometriosis front, what are some kind of common signs that someone may have endometriosis?
Pain, everyone's experience is different and really interesting. I think since I've been working more and more in this space, I've had lots of different people's experiences with endometriosis and how the symptoms have arrived and also maybe flared at particular points in their lives, whereas before they had painful periods but no other additional symptoms. So I would say pain is really significant, particularly pain during periods. Sometimes people might experience blood in their stool, um, and other symptoms that you think, oh, what's going on? Uh, is this just period pain or is there other things? Difficulty or pain with peeing, those kind of symptoms, particularly if the endometriosis is around the bladder. So that's our organ that helps us to store urine and to then pee, and around the bowel. So that's what helps us to hold our poo. That's why sometimes the symptoms are to do with urine, to do with periods, and also to do with our pooing.
Yeah, that makes sense. And if anyone again is experiencing those symptoms and they think, oh gosh, like maybe I have endometriosis, is there anything that you would recommend they kind of like log or anything that any way in which you think they should communicate to their GP when they go and query that?
Yep. Firstly, when you come in, after we've done our pleasantries, you say, I think I've got endometriosis. I think so because I've been having really painful periods. And in addition to that, I also have noticed a little bit of pain when I pee, or blood when I poo, or pain in my tummy as well. I think it's endometriosis because I've had a look at the NHS website and I've seen some of those symptoms, and I actually have five of the symptoms. I would like to know what I can do to get closer to a diagnosis. what do you recommend? Or, and then the doctor might start to ask questions, unpick things a little bit more. But that way you've really presented what you think is going on and why you think that's what's going on. And also said, I think it's a great idea to look at the NHS website because one, it's validated. And if you come to me as your doctor and say, Dr. Rumbi, I've had a look at the NHS website. These are the symptoms that point to this condition. I'm having four of the five symptoms. I mean, for me, that makes sense. In my knowledge, then I can say, actually, these four or five symptoms can also mean this. That's a different story, but it means that we've addressed what your ideas, concerns, and expectations are, whilst also being safe and including and excluding other things that could be causing those symptoms.
Yeah, I love that advice. I think it's really helpful, especially because the NHS website is so accessible for people. So it's an easy resource to turn to that could really help them get the most out of their appointments. And are there any kind of misconceptions you think that people have about GPs?
Yes, so many. And I'll be interested to hear any from your clients or your life experience as well. I wanna hear some misconceptions too, but I find that it's very easy to bash GPs. The
Yeah.
specialty doctors are like, oh, your GP didn't do this. Oh, oh, these GPs. The media is also very anti-GP right now. So it's quite difficult. I think one of the most important things that I love to stress is when we say the GP, that refers to all the clinicians that you see within a GP surgery. You might see a doctor. You might see a doctor that's not a GP, but working within the GP surgery. You might see a nurse practitioner. So, advanced nurse practitioners, they see patients, they do a lot of the same work. You might see a paramedic specialist. You might see the practice nurse. So, for example, when you go for your smear test, I've never had a doctor do my smear test. All my smear tests have always been by nurses. But I say I'm going to the doctors, I'm going to the GP to get my smear test. So, the fact that there's different, when we just use the word GP as a whole, but there's different people in there, everyone has different roles. Sometimes when I'm in hospital, as in working in hospital, a patient or someone would come in and say, well, the GP told me to come to A&E. When you actually unpick it, they spoke to the receptionist at the surgery who said, oh, if you have these symptoms, then you need to go to A&E. They never spoke to a doctor or a
Yeah.
clinician, but we just use the word GP as a whole. So that's one of the biggest ones. One of the biggest misconceptions that I would love to break is it's not just GPs that see patients in GP, it's other people as well. And when we speak about it as a whole, we then taint the GP doctors with the same bracket. But I wonder what misconceptions you've had or some of the things that you've had that you would love us to myth bust or confirm.
I think one of the main things is people generally tend to assume that GPs are specialists in everything, when in
Mm,
reality, they have a good amount of knowledge across the board, but they're not specialists in every area. And so they don't always have all of the answers. And that's okay. They're there to help you find the answers, but they're not specialists in every single area.
absolutely. I think general practitioners as doctors are experts in family medicine. They're experts also in picking up what needs to be referred, so what needs that specialty input versus general day-to-day medicine. So it can be tricky in that range. But also, I think what we should, as individuals, never be afraid of is knowing more than our doctor. If I'm experiencing a condition, I am going to dig deep into that. I'm going to research everything. I am going to find out like the latest this, the latest that. So if you come to your appointment and you know more about the condition than your doctor, than your GP, I don't think that's an unusual experience because and it's good to know more about the condition that you're experiencing. So I think that's also an important thing because people be like, well, I knew more than the doctor. Yes, of course you did, because you really have leaned in and got to know more about this condition. I think that's important, but don't be don't be surprised if that happens, for example.
Yeah, 100%. And I think another thing is that people, again, kind of tying into the same point, people kind of sometimes expect GPs to like have the answer for everything when in reality they are still learning. Like they could be at any stage in their career, just like anyone, just
Hmm.
like myself as a coach, like
Hmm.
still learning. I'm still progressing as a human and a professional, just like everyone else in the world. And I think sometimes people kind of like they're like, why does my GP not know this? When it's like they're a human too, they're progressing too, they're learning, and they could be at any stage in their career.
Absolutely. And the important thing on the other side, as the doctor, is to be able to say, I don't know this, but I'm going to find out. And I love one of the things that we have access to, and it's in the NHS in England. I don't know if it's across the board in terms of Northern Ireland, Wales, and Scotland, but it's something called advice and guidance. So as doctors in GP, we can send for advice and guidance to specialties. It's where you think, I'm not quite sure about this. What do you, as the expert, think? And then they will write back to us with an answer. Sometimes the specialties can be very sharp, dare I say, sometimes even a little bit rude when we ask them for this advice and guidance, but that option is there. And I think what's important as the doctor when you are unsure or you don't know something or you haven't experienced it before is being open about that. This is an area that I'm not familiar with, that I'm not as familiar with. I will look into it by either sending advice and guidance, discussing with my colleagues, because that's an option as well. And then I'll get back to you via phone call, via text message, or we'll book a follow-up in 2 weeks and I'll get back to you at that point, making a plan, being
Yeah.
open and also then making a plan.
Yeah, I love that. And I think finally, probably the last thing is that people sometimes believe, especially like you said, in today's day and age, that like GPs don't care, when in
Mhm.
reality, like they're not exactly set up with a system that allows them to always do their best. Like, you guys have very limited time, very limited resources, and it's not that obviously there are in any profession, there are great coaches, for example, and then coaches that aren't as great, that are
Hmm.
maybe, don't care so much for the clients in front of them. And the same applies for any other profession. But generally, I think it's a bit of a misconception that you guys like don't care, when in reality, it's just that the system is not set up for you to give the time that you'd ideally like to give, and the resources that you'd ideally like to give.
I think no one leaves their house to be a bad doctor. No one gets up in the morning, gets dressed, goes to work and says, I'm going to be a terrible doctor today. I think we all leave the house with the same endeavor, and that's to do the best for our patients. But human factors are also something to consider.
Yeah.
So you and I might have the exact same consultation. And because of maybe who I am as a person or who you are as a person and how I deliver information and how you deliver information, we don't actually end up having a good consultation. But take someone else and we do the exact same interaction, or I present information the exact same way, and someone else is like, oh, that was great. So
Yeah.
just like you said, they might be really good coaches and really bad coaches. They also might be a really good coach for me,
Yeah, 100.
and that good coach for me might not be the good coach for you. So that also is something.
Yeah, and I think it's really important for people to hear that, and I guess to consider doctors and any other medical professionals as humans, just
Hmm.
like everyone else, rather than as like robots, and to understand that everyone's just generally like trying their best. And I guess if you go into a doctor's appointment with this mindset of they don't care, like, and that I'm just going to be dismissed, that's probably how you're going to come out feeling. Whereas if you're
Mm,
more optimistic and open and maybe a little bit kind of more um more optimistic about how the appointment is going to go, you probably have a better outcome.
absolutely. And I think that's one thing that actually GP and general practice can do well is if you find a doctor at your surgery that you feel you've got a good rapport with, or you think that actually they're
Um,
fantastic.
Sorry, I lost you there, Rumbi. What were you saying? You started with if you find a doctor that you kind of gel with.
Yes, if you can. asked to see them again. It's not always possible. And sometimes it means waiting a little bit longer for an appointment because not everyone works every day. And then the day that they work, you might not be available. But that might be a way forward, is saying, okay, this is the person that knows the story, and I actually really enjoyed our consultation. So I'm not going to jump around. I'm happy to wait a little bit longer for an appointment if that's what's needed, but I'm going to stick with this doctor for this issue. And you might actually find that that happens. So you see one GP at the surgery for your joint pain and your knee pain because you like how they manage it. And then you see another GP at the surgery for maybe skin complaints or your women's health concerns because you like how they manage it. So don't be afraid to say, no, 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 for this, I want follow up with Dr. Rumbi. And then for something else, you say, actually, no, I won't follow up with Dr. Danny because
Yeah.
that's what I want to see her for. So you also have a little bit of flexibility there.
Yeah, I think that's super helpful for people to hear. And moving on to Glaciehealth, what kind of inspired you to set Glaciehealth up and what's your mission statement with it?
Inspiration wise, it's really, I think, all the years of experience that I've had working in women's health, seeing the disparities in terms of care and outcomes for women, the lack of research for women's health, and the fact that women have to often shout a little bit harder to go beyond the not being listened to and actually be heard. And that developed in a variety of ways. And I've been an advocate for women's health for years, years and years and years, that I thought actually now it's time to have solutions. I can't just be on the picket line. What is something that we can do to provide a solution? So that's where we developed. And in terms of what we do, we actually are not working with individual women, so providing woman to woman services. We are working with companies and businesses to really optimize the services, the products, and the offerings that they have for women to make sure it's what women want, not just, oh, I think this is a good idea. I'm going to make women have it or make women want it. It's like, does it actually serve their needs? Is this what they want? Is this what they need? You know?
Yeah, I love that. And so you work obviously with businesses. What services or support do you actually offer?
So I guess, use some of our clients as an example. We have a client who, oh, we can start with actually doctors either. So we have a client with a campaign called They Are Not Bad Words. So when we were talking about vulvas, we're talking about the word vagina, clitoris. A lot of the time, if we were to ask the general public to point to the vulva, they wouldn't know necessarily what that is. They might point to that whole area and say, okay, that's the vagina, whereas actually that's not the vagina. The vagina is the internal that goes from the outside to the neck of the womb, which is the cervix. And why this is important, one, is when you come to me as your doctor and you say, I've got pain in my vagina, then I'm already thinking the pain is inside. Maybe you've got pain on your vulva, actually. And that's a different thing to pain on your vagina or in your vagina. So that's a really important thing to consider. Another thing of why the words, knowing the right words is important is just safety, particularly for our children.
Yeah.
They know if someone touches me on my vulva, or they're more able to describe things. So I think that's really important. So we've supported the campaign and helped them put together their activation and really getting the message out there. So that's some of the work that we do.
I love that.
So that's one example. Another example is one of our clients who, I don't want to, okay, the product is not quite ready, but we're helping them shape the design of the product. It is a women's health product, and get information from women. Ask women, what do you want? Is this something that you want? Do you think you would use it? Do you think you need it? And if you were to have this, what would you want it to do for you? Those types of insights and information. So communicating the messages, but also gathering the information, doing that research, and helping shape the products themselves and the services.
That's brilliant. And finally, have you encountered any of your own personal women's health challenges?
I really have, and I find it such a interesting way to navigate, particularly with being a doctor and
Yeah.
trying not to be like, I'm a doctor too. I think this and I think that, and really stepping into being a patient or being on the receiving end of care. And that can really have its own challenges and its own pros because I might be the expert in my body and I might have a wealth of knowledge, but if I'm coming to a specialist, then I come in the sense that I'm not an expert in this and I'm really intrigued for your specialist opinion and your specialist input. And so, yeah, it can be really interesting to navigate. There's been positive experiences, of course, there's been less positive experiences, and just trying to toe that line can be difficult. But I know I have an immense privilege and advantage because I am a doctor. And if there comes a point where I feel actually maybe this person's not hearing me, at the point that I am now, maybe not previously in my career or previously in my life, but at the point that I am now, I'm very able to say, actually, maybe do you think this? Or why don't we try this? Or why are we not trying this? Or can you explain to me a bit more why you think this is the case?
Yeah. And do you feel like your own experiences have helped you in your practice as a doctor?
I think there is someone who says that they leave their life experiences at the door when they come to work. They're lying. Like we're shaped by all the things that we've experienced, and it dictates how we respond to certain situations. In the same way that, for example, if a doctor has endometriosis and someone comes in with endometriosis symptoms and they've been gone on a long journey, they might actually be able to present a different type of empathy to a doctor who has never experienced this and is just like, okay, I know it's a painful condition. I'm empathetic to the fact that you're experiencing this pain, but that lived experience, it definitely adds a different element.
Yeah, I love that. And finally, have you got any kind of final words or piece of advice for the listeners when it comes to navigating their own women's health journey?
Yes, I think about what you want. What is the ideal outcome for you on this journey? Because some conditions, and if you do a little bit of research on the conditions that you think might be experiencing, some conditions may not have cures. And so if you think that's the condition you have, is having the diagnosis the important thing that you want to know?
Yeah.
Or does it actually not matter? Where you think, actually, you know, I've got this. I'm living my life with no issues, so it is what it is. So think about what you want versus thinking, actually, I've got this. Oh, I think I've got this, but all I really want is confirmation that this is the case, validation of my concerns by getting that diagnosis. And then the alternative is, I've got this, I know I've got this, and I need a solution. I need a cure. I need something because it's really impacting on my way of living. So just thinking about what you would want from your women's health journey, thinking about the end helps shape how to get there, I think.
Amazing. Today's podcast has been fantastic, Rumbi. Thank you so much for your time. It's been a pleasure to have you, and I hope those of you listening have enjoyed today's podcast. For those who might want to find your content on social media and that kind of thing, where can they find you?
Um, you can find me on YouTube. I do a lot of women's health content in YouTube, and it's Dr. Rumbi on YouTube. Um, Instagram, Dr. Rumbi, and Glaciehealth on Instagram and TikTok.
For those of you listening who want to find Rumbi and her content, I will put all of the details in the description below. So go and give her a follow. Thank you so much for listening, and I will see you next week.